Well, really the best reason to get vaccinated is to protect yourself, to make sure that you don't come down with a severe case of COVID-19. But it's also important that we protect our family and our loved ones and our friends and neighbors and our community as a whole. And so really, it's on all of us to ensure the health of our community by taking advantage of this opportunity to be vaccinated when it comes to us. So this is a 2-dose vaccine. The first dose is administered. You will be asked to wait 21 days or 3 weeks, at which point you will come back and receive a second dose. We know based on the clinical trials that full protection is achieved 2 weeks after the second dose. So from the point you take your first dose to the point you have full protection is about a 5 or 6 week process for our body to fully respond and to establish that protective immunity that we're seeking with this vaccine. Not yet. It's still important as this vaccine rolls out and over the next several months as we vaccinate more and more people in our community that we still adhere to the public health guidelines that we've been using over the past several months. We still need to continue to wear our masks. We still need to continue to socially distance. We need to limit our gathering. And as the number of cases come down in our community and in our state, those restrictions will begin to relax. But until we can cover our entire population with this vaccine, until we can drive the number of cases down to zero or very close to zero, we still need to continue to adhere to these very easy public health practices that are helping control the spread of this infection. That's a difficult question to answer right now. I think if we can bring the number of cases down in our communities, if we can interrupt the chain of transmission, if we can drive this virus out of our communities, then we'll see some of these restrictions like masks begin to perhaps go away. But that takes cooperation, that takes involvement of everybody, not just with the vaccine, but continuing to stick to our public health practices, to do what we can do to limit the spread of this infection and hopefully make it a thing of the past. So if you only take 1 dose of this vaccine, you will achieve some level of protection. Your immune system will respond, but it will not be optimal. It will not be the 95% that's been reported. In order for us to achieve that very high level of robust protection against this disease, we need 2 doses. We need to stimulate our immune system not once but twice, and the second time that our immune system sees the vaccine, it responds very strongly and establishes a high level of protection that is sustained, again, for at least several months. Without that second dose, the protection is likely only transient, and it's not at the level that we would like to see. So that's why it's critical that you receive both doses of the vaccine. So we encourage everyone to continue to abide by the public health orders that have been established by the state and adhere to the guidelines as established by the Centers for Disease Control. As we see the number of cases begin to come down over the next few months, we hope that we'll be able to begin to resume our normal lives as we remember them from before COVID. The other critical point right now is that, believe it or not, we don't know with certainty whether this vaccine actually prevents transmission. We know based on the studies that it prevents severe disease in those who receive the vaccine, but we haven't been able to determine whether those individuals that are vaccinated are now incapable of transmitting the virus to someone else. Until we have that data, we can't say for sure that this vaccine will actually block transmission. So for that reason, we do need to continue to adhere to our public health practices, continue to wear masks, continue to socially distance until those are relaxed by the state. We know that we've established a level of protection in our communities that is sufficient to protect us all from severe disease, but also hopefully drive the virus out of our communities.